India is a land of paradoxes. Here we have the best in world healthcare on one hand, and on the other, there are millions who don't have access to the basics. This is one of the biggest challenges that India faces, and Kiran Mazumdar-Shaw, one of India's best-known entrepreneurs, tries to find the answers.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. Today's guest is a man who is creating a new identity for our country. Nandan Nilekani, who heads the all-important Aadhaar program. Over the next 30 minutes, I will be brainstorming with Nandan to see how we can leverage the UID program to provide key building blocks on which to create a comprehensive healthcare system for India. Thanks, Nandan, for coming on this show and sharing your thoughts on how do we build a national healthcare system. You know, we have 1 billion plus people in terms of a population size, and we want to deliver healthcare for all. But where do we start?
I'll talk about the information systems for this gigantic project. I think what we're doing in the UID or the Aadhaar project is to give a unique number to every Indian resident. And that number is very important because that number is going to be unique and it will be biometrically authenticable on the network. So if you go somewhere and say, "Your Kiran, this is my number, this is my fingerprint," we'll confirm that you are that person. Then attached to that number, we can have the electronic health record of the person, and that record, and that's, I think, very important. The design of that record is very important. And today, for example, if you look at the US healthcare bill, you know, they're spending literally billions and billions of dollars on getting all their health systems to talk to each other. Hospitals, payers, payees, you know, pharmacies, all that. We don't need to reinvent that. We can build a fresh network, and that's why thinking through the interoperability is very important.
And I think that's why sort of, you know, this is a very important phase for all of us, you know, because this is the time when we are trying to sort of shape a new system, and this is where we have to make sure that we use technology in the best possible way to build a very efficient, optimal system.
Absolutely. I think at the same time, one thing very important in the health area is the privacy issue. Because, you know, if you have some ailment, you don't want somebody else to know. And that's where the Aadhaar helps, because Aadhaar has a biometric, you can only open it with your biometric. So the only key is your biometric. So somebody else can't access your health record. So we also handle the privacy part of it.
And you're almost kind of leapfrogging in terms of how you're building a new healthcare system. In fact, it's something that others would love to emulate. Because much as we talk about, you know, the healthcare systems in developed countries like, you know, the US and many European countries, we know that these are very inefficient when it comes to actually delivering healthcare to their citizens.
Absolutely. I think one is they have this whole legacy issue where they have this hodgepodge of systems which don't talk to each other, and a lot of people in the ecosystem have an interest in not sharing the data. Like a hospital may not want to share its hospital records so that they don't want to lose their, you know, customers and so forth. The other thing is that so this legacy issue is a big issue, and I think before the legacy issue set in here, we need to lay the parameters.
No, and you know, if you look at, you know, what this kind of a database allows you to do, and also the use of software technologies in mining all this data that we are going to be generating.
I think once you have this basic Aadhaar as the foundation for identity, you have the electronic health records. You can then, as the data flows to this system, you can extract information and intelligence from that. For example, if there's a sudden outbreak of some kind of epidemic in a particular area, you'll suddenly see a lot more cases popping up there. And then you know that you need to do something about that.
Yeah, so forecasting becomes very
all
easy.
Kinds of things that you can
But even, you know, apart from that, you know, Nandan, one of the biggest problems that we have in India is that we are a developing economy with the disease burden that is comparable to developed economies. Now you look at, you know, whether it's infectious diseases, which is the developing economy challenge, or the diabetes and lifestyle disease challenge that we have in terms of cardiovascular disease, cancer, you know, and of course diabetes. Now here I think again we need to be able to leverage all our skills in software, information technology and Aadhaar in seeing how we can do resource planning, how we can do forecasting, how we can mine this data to in a research oriented way to actually give us new clues about disease management.
Yeah, you know, you can have, for example, cancer registries where today what happens, often the same person goes to 3 different hospitals because they have something and they don't get the solution in one place, they try to go somewhere else. So those kind of things you can, this thing. Then you know, blood transfusion, another big area, because you want to tag that blood with and make sure that it's, you know, free of any disease.
And that you don't have to keep doing blood tests all the time.
Again, all that can be done. Then organ transplant registries. Again, you can create a national organ transplant registry, and then you can have whatever logic so that you can make sure that it goes to the right people. I mean, there are many things we can do.
Absolutely, and you know, I think that's where I think we would like to really look upon, you know, this whole sector, the software services sector, the information technology area, to see how we can actually leverage all these various technologies to integrate and build this very, very powerful system.
Sure.
And of course, we also know that there's a big challenge in India that today any form of quality healthcare is almost kind of confined to urban India, whereas rural India is almost devoid of any access to decent healthcare. So that's another big area we have to tackle.
Absolutely.
Through telemedicine, through many, many other aspects of technology.
Oh, absolutely. I think, for example, now there are a lot of diagnostic tools available at the tip, like using a mobile phone, you know, diagnostics, a wide variety of diagnostic tools. So if you can combine those diagnostic tools with the network, Aadhaar as the identifier, and have the data on the cloud, then the person at the point of service delivery need not be a doctor, it can be a paramedic, and they use these tools. So we can come up with a whole new thing. Is we have to think differently in the way we deliver these services.
For Kiran Mazumdar-Shaw, one of India's most famous women entrepreneurs, ensuring healthcare facilities for every Indian has been a passion. And as she sits down with the man behind the government's ambitious UID project, Nandan Nilekani, the question is, how can Aadhaar and the new trends in technology help access healthcare better?
Today, with all these new powerful technologies like cloud computing, where you can store your data in a very effective and
the advantage of cloud
way.
computing is that you're mobile. I mean, like once my record is on the cloud and can only be opened with my biometric, then whether I go to hospital in Bangalore or Delhi or somewhere else, I can unlock my record and have it accessible.
But the most important aspect is how do we make sure that this medical network of hospitals that we have actually link into each other, share databases, and you know, that's where I think again Aadhaar can play a very
important role. I think
role.
Governance is very important because we must have rules on sharing. In other words, my record is not the ownership of one hospital. It's mine. It's my personal information, and therefore wherever I go, I should be able to get my personal information. What happens in some of these more developed countries is that the record is inside a hospital, and then you can't get it out, and you know, all those kind of issues. A couple of other things I just want to add, Kiran. One is immunization. Now, immunization is a big problem in India, because the number of fully immunized children varies anywhere from 30 to 70, 80%. Some states is as low as 35%. And part of the reason is there are no records, because immunization is something that happens over, say, 2 years. So you immunize, say, 2-3 times, and then the record is, the child moves somewhere, and the record remains. Now, if you put the immunization record on the cloud, then even if the baby is moving around, we can track it. So immunization is a very important benefit that.
Absolutely, this is a very, very important point that you have raised.
While technology and identity promise to resolve this fragmentation, another glaring challenge that our healthcare system is grappling with is the issue of medical insurance. Only 11% of the population has some form of insurance coverage, and the absence of an adequate insurance system just compounds the challenge.
The other aspect, of course, is about health insurance itself.
Oh,
you
yes,
know,
yes.
We need to have a very strong national grid in terms of the insurance mechanisms.
Absolutely. You need portable products. I think, again, it comes to create portability, because a hospital should be able to get a patient from any insurance scheme. A patient should be able to buy any insurance policy. And you also want to have low-priced insurance, you know, like what
That's
we have
right.
done in Karnataka.
The micro health
Yeah.
insurance.
Now, for that, you need a network of places where I can pay small amounts of insurance premiums. So it's linked to the financial inclusion. So, you know, all these
So
things are
microfinance,
Yeah.
micro insurance,
Yeah, yeah.
all these need to be tied
Yeah.
up. I think it's
Yeah.
a huge challenge, but a huge opportunity
You
as
should be able
well.
to go to, in a village, a person paying 20 rupees a month should be able to get a decent health insurance policy.